Absence of iris, like aniridia. Is it Weger? Wilms tumor. So it's Weger syndrome. These these newborns absent iris and genital abnormalities, hypospadias and cryptorchidism. Hypospadias and cryptorchidism raise suspicion of Weger syndrome. 11p, a deletion of syndrome. Weger syndrome typically results from de novo deletion on chromosome 11p13 is an acronym and from its associated condition Wilms tumor, hereditary absence of iris, genital abnormality, and range of developmental delay. The diagnosis should be suspected if the two or more than two of these conditions are present and confirmed with genetic testing. Wilms tumor nephroblastoma is a renal malignancy that occurs in approximately half of the patients with Weger syndrome and is due to deletion of the WTA gene within the affected chromosome region. In contrast to isolated Wilms tumor, which is usually unilateral and presents at age 2 to 5, Wilms tumor in Weger syndrome is often bilateral and presents earlier. Therefore, serial screening abdominal ultrasonography is performed beginning in infancy and throughout early childhood for early detection. Despite strict surveillance, end-stage renal disease develops in many patients. Okay, what is your diagnosis? Wait. He has UTI. So recurrent UTI. What is your diagnosis now? What viewer due to recurrent UTI? Recurrent UTI, one of the uh, thing is calyces. Okay, okay, recurrent posterior urethral valves can happen due to recurrent UTI also. Like posterior urethral valve, is posterior urethral valves risk factor is recurrent UTI. Okay, okay. But posterior urethral valves for boys, not for the boys. Okay, UTI in infants, recurrent UTI in infants and children children are a serious problem as they often involve the kidneys, signifies signify a congenital urinary tract anomaly, one of the most one of the most common abnormalities in primary viewer. Normal urine should have unidirectional flow from the kidneys, ureter, bladder, and out of the urethra. Patients with severe VUR have urine reflux from bladder into the kidneys. The regurgitant urine beta blocker of beta blocker of the ureters, hydroureter, and the kidneys, hydronephrosis. Bladder, renal, pelvis. This is cystourethropathy, vesicoureteral reflux. The definitive diagnosis of vesicoureteral reflux is made by contrast widening cystourethrogram. Renal ultrasound is performed to screen for hydronephrosis. Recurrent or chronic pyelonephritis can lead to blunting of the calyceal clubbing, and focal parenchymal scarring. And dimercaptosuccinic acid. Renal scintigraphy and dimercaptosuccinic acid is preferred modality for long-term evaluation for renal scarring. Renal function should be followed by serial creatinine. Patient should be monitored closely for complications of chronic renal insufficiency such as hypertension and anemia. Okay, So this patient has a history of renal transplant and severe persistent hypertension in association with acute kidney injury that develop after initiation of lisinopril. The presentation suggests renovascular hypertension due to transplant renal artery stenosis. Although most cases of renal artery stenosis occur in elderly men with diffuse atherosclerotic disease, it can also occur in patients with transplanted kidney and is commonly associated with operative abnormalities, trauma during organ procurement, abnormal suture placement, viral infection, cytomegalovirus, BK virus, and atherosclerosis of the donor kidney. Transplant RAS typically occur in the first 2 years after transplantation. Similar to renal artery stenosis due to other cause, transplant RAS typically manifests with resistance hypertension, a decline in renal function after the addition of AC inhibitors or angiotensin II receptor blockers is highly suggestive of diagnosis of other findings that suggest renal artery stenosis include lateralizing abdominal bruit, recurrent flash edema. The diagnosis is made with renal vascular imaging, renal Doppler ultrasonography, and management of renal artery stenosis include angioplasty, possibly stent placement. Okay.
It's 55 when it comes to the EV
That one, AMP, like Staghorn calculi. Are you talking about Staghorn calculi? Magnesium ammonium phosphate. Ammonium magnesium phosphate or like that. Okay, this patient has large irregular kidney stone, large irregular kidney stone associated with recurrent UTI, a presentation suggestive of struvite stone, magnesium ammonium phosphate stone. Struvite stones are caused by urease positive, sorry, magnesium ammonium. Struvite stones are caused by urease positive organism Proteus klebsiella, hydrolysis of urea yields ammonia, which alkalizes the urine and facilitates the precipitation of the struvite crystal. Although many patients with nephrolithiasis have stones of mixed composition, some individuals, particularly women, produce pure struvite stone because of large quantities of area excreted in urine. These stones can grow rapidly and fill the renal calyces tag on calculi. The size prevents these calculi from passing into the ureter, so patients typically have symptoms to stag on related to associated recurrent UTI rather than the acute renal colic. Education of stagnant calculi is difficult. Antibiotics alone do not eliminate the source of infection because bacteria grow within the stone matrix. Definitive treatment typically requires complete stone removal, percutaneous nephrolithotomy, because any residual stone fragments continue to seed infections, and nephrectomy may be required when recurrent infection and obstruction results in a chronically infected, non-functioning kidneys. Okay. Yes. Dietary oxalate forms complexes with calcium in the interstitial lumen and is eliminated in the feces if the intestinal calcium concentration is low. If the intestinal calcium concentration is low, low calcium diet, fat, malabsorption, absorption of free oxalate is increased. Absorption of free oxalate is increased. This increased load is filtered by the kidney, which then can be calcium oxalate stone. Although a small oxalate stone may be serve as an gas for the formation of struvite stone. Struvite formation is related temporarily to urinary ammonia rather than calcium and oxalate. Okay. 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 Yes, obviously.